Hi, and welcome to our training on early steps, start to finish. This training will go over Louisiana's early intervention program known as EarlySteps. I'm Sharon Blackman. I'm the Director of Training at Families Helping Families of Greater New Orleans, and I'll be your presenter today. FHF of GNO, Families Helping Families of Greater New Orleans, is one of 10 nonprofit family resource centers in the Families Helping Families network of centers. And we're here to provide support to parents of children, youth, and adults with disabilities or special healthcare needs. We do this through individual assistance, information sharing, outreach, and trainings like this one. Families Helping Families provides over 100 training opportunities each year on special education and disability-related topics. So check out our calendar of events at fhfofgno.org and register for any upcoming trainings that might be of interest to you. As a result of this training, I hope to increase your knowledge and understanding of early intervention and early steps, early steps referral process, what happens after your child is referred, the early steps transition process, and resources that are available to you. This is a list of acronyms that you may hear often when talking about early intervention, early steps, or special education services. I call it alphabet soup because for a parent thrown into this setting for the first or the 15th time, the acronyms are unsettling and can cause you to feel unprepared. I'll try to define the acronyms as I go, but here's a helpful list for you as you begin learning the jargon related to early steps. EI is often seen on paper, early intervention program, and in Louisiana, EI is early steps. IDEA is the Individuals with Disabilities Education Act, and that's the federal special education law. SPOE, S-P-O-E, is the system point of entry, and that can refer to the system point of entry for early steps or for developmental disability services. FSC is the Family Support Coordinator for early steps. IFSP refers to the Individualized Family Support Plan, and that's the document that drives the services a child receives in early steps. BDI-2, that's the Battle Developmental Inventory Test, and it's the primary test used to determine eligibility for early steps. LEA is the Local Education Agency or the local school district. OCDD is the Office for Citizens with Developmental Disabilities. HSA or HSD is the Human Services Authority or district, and that's the system point of entry for developmental disability services, including waiver services. IEP is the Individualized Education Plan or program, and that's the document that drives the supports and services a child receives in special education under Part B or school services. FAPE is Free Appropriate Public Education, and DD refers to Developmental Disabilities Services, which we'll get into briefly when we talk about transition. So what is early intervention? Early intervention is the term used to describe the services and supports that are available to babies and young children with disabilities or developmental delays, as well as their families. Early intervention focuses on helping eligible babies and toddlers learn the basic brand new skills that typically develop during the first 3 years of life. And that might include physical skills like reaching, rolling, crawling, walking, cognitive skills, thinking, learning, problem solving, communication skills, talking, listening, understanding, social emotional skills like playing, feeling secure and happy, and self-help skills, which would include eating and dressing oneself. Early intervention is authorized by law. It's available in every state and territory of the United States. The Individuals with Disabilities Education Act, or IDEA, requires it. Part C of IDEA, to be precise, is where early intervention is explained. And that's why you'll sometimes hear early intervention referred to as Part C services. Who is eligible for early intervention services? Early intervention is intended for infants and toddlers who have a developmental delay or disability. Eligibility is determined by evaluating the child with the parent's consent to see if the little one does, in fact, have a delay in development or a disability. Eligible children can receive early intervention services from birth up until their 3rd birthday. Sometimes it's known from the moment a child is born or even earlier that early intervention services will be essential in helping the child grow and develop. Oftentimes, this is for children who are diagnosed at birth with a specific condition or who experience significant prematurity, very low birth weight, some sort of an illness at onset of life, or surgery soon after being born. Even before heading home from the hospital, this child's parents may be given a referral to their local EarlySteps office. Some children have a relatively routine entry into the world, but may develop more slowly than others, experience setbacks, or develop in ways that seem very different from other children. For these children, a visit with a developmental pediatrician and a thorough evaluation may lead to an early intervention referral. What is EarlySteps? EarlySteps, as I said earlier, is Louisiana's early intervention program. It provides services to families with infants and toddlers from birth to 3 years of age or 36 months who have a developmental delay or a medical condition that's likely to result in a developmental delay. Children with delays in cognitive, motor, vision, hearing, communication, social, emotional, or adaptive development may be eligible for services. EarlySteps services are designed to improve the family's capacity to enhance their child's development. These services are provided in the child's natural environment, like their home, their child care center, or any other community setting that's typical for children from birth to 3 years of age. When and how do I access EarlySteps? If you, your child's doctor, or another care provider is concerned about your child's development, ask to be connected with EarlySteps to find out if your child can get services to help. Children can be referred to EarlySteps by their parents or by a professional by contacting the system point of entry or the SPO in their region. Parents don't have to wait for a professional to refer their child. Once the SPO receives a referral, parents will be contacted to begin the eligibility determination process. Here's something that you may want to say to the early intervention contact person. If your child is under age 3, you can call the EarlySteps office in your region of the state, explain that you're concerned about your child's development, say that you think your child may need early intervention services. That's a key phrase, early intervention services. Explain that you would like to have your child evaluated under Part C of IDEA. It's a good idea to write down the names and phone numbers of everyone you talk to as you move through the early intervention process. And of course, if you need help with finding the SPO in your region, please call your local FHF center and we will be happy to help and to give you other ideas of things that you can say to the person you call. It's a little intimidating when you first call and you don't even have an idea of what you want to say, but we can help you with that. Once your child is referred to EarlySteps, they will be assigned an intake coordinator who will explain the early intervention process and will help you through the next steps in that process. One of the first things that will happen is that your child will be evaluated to see if indeed he or she has a developmental delay or a disability. The intake coordinator will explain what's involved in the evaluation process and will ask for your permission to proceed. You must provide your written consent before screening or the evaluation may take place. The evaluation group will be made up of qualified people who have different areas of training and expertise. And together, they know about children's speech and language skills, physical abilities, hearing and vision, and other important areas of development. They know how to work with children, even very young ones, to discover if a child has a problem or is developing within normal ranges. Group members can evaluate your child together or individually. As part of the evaluation, the team will observe your child, ask your child to do things, of course, if they're old enough, talk to you and your child, and use other methods to gather information. These procedures will help the team find out how your child functions in those 5 areas of development that we discussed. The results of the evaluation will be used to determine your child's eligibility for early intervention services. You and a team of professionals will meet and review all of the data, results, and reports. The people on the team will talk with you about whether your child meets the criteria under IDEA and state policy for having a developmental delay, a diagnosed physical or mental condition, or being at risk for having a substantial delay. If so, your child is generally found to be eligible for services. If eligible for services, the team will then develop an IFSP, or an individualized family service plan. What does EarlySteps offer? The EarlySteps system is designed to support families, not just the child, but the family regarding the child's development. And they do this in several ways. They assist families in helping their child to develop and learn. They assist families in understanding their rights in early steps. They help families in communicating their child's specific needs. And they help determine a family's concerns, their priorities, and the resources regarding their child's special needs. The following are some of the services provided by EarlySteps: service coordination, speech language services, special instruction, occupational therapy, physical therapy, audiology services, and other services based on individual need. So who pays for the services? Whether or not you as parents will have to pay for any services for your child depends on the policies in Louisiana, which, as we all know, can change from time to time. Check with your service coordinator. Louisiana's system of payments must be available in writing and given to you so that there are no surprises or unexpected bills later on. Under Part C of IDEA, the following services have to be provided at no cost. Child find services, and that's where the state is required to locate children who have a disability or a delay, developmental delay. Also required to be provided at no cost, evaluations and assessments. So that initial evaluation by the team will be of no cost to you. And also the development and review of the IFSP, that document that outlines the services that will be provided through EarlySteps. So all of those things are free. Depending on Louisiana's policies, you may have to pay for certain other services. You may be charged on a sliding scale fee, meaning that the fees are based on what you earn. Every effort is made to provide services to all infants and toddlers who need help, regardless of family income. Services cannot be denied to a child just because their family is not able to pay for them. So keep that in mind and don't be discouraged. So what are the time frames for all of this? When the early intervention system receives a referral about a child with a suspected disability or developmental delay, a time clock starts running. Within 45 calendar days from the referral, the early intervention system must complete the critical steps that we've discussed so far. And that would be the screening, the initial evaluation, the initial assessments of the child and the family, and the writing of the IFSP if the child has been found eligible for services. Now, that's a tall order, but important given how quickly children grow and change, especially in those first 3 years. When a baby or toddler has developmental issues, they need to be addressed as soon as possible. So 45 days, that's the time frame from referral to completion of the IFSP for an eligible child. Here's a timeline flow chart You want to make sure that the timelines are being followed so that you do not exceed your 45-day timeline. You don't want them to stretch this out because it's your child's services that are at stake. So as you count, if you count as day one, the day the referral was received at the SPO, the system point of entry, then on day three, then that's working days, not calendar days. On day three, the intake coordinator should have already made initial contact with the family. That referral should be acknowledged in writing by day 5. And by the 10th working day, an interview with the family should have been held. On day 45, all the steps should be completed and the IFSP should have been written if the child was found to be eligible for early steps. So what's next? As we've stated, each eligible child and their family must have an individualized family service plan, or IFSP, developed no later than 45 calendar days from the date of receipt of the referral at the SPO, the system point of entry. So let's talk about that, an IFSP, and exactly what an IFSP is. First off, who are the IFSP team members? And it is a team. In identifying the IFSP team, members should be chosen on the basis of the child's needs and expertise needed to develop an appropriate IFSP. The team members are selected at each meeting meaning when they have to be reviewed and annual meetings are done. The team members are not necessarily the same from one meeting to the next. So they are selected for each meeting, and the team may not necessarily continue as ongoing service providers for the child. So the person that is the speech language pathologist at the initial meeting may not be the person who sees the child for speech language services. The intake coordinator must show the family the service matrix to select providers with special skills, information, or expertise that is important to the family. These are the required IFSP team members: the parent or parents of the child, other family members as requested by the family, an advocate or person outside the family if the parents request that, an intake coordinator, and that's for the initial IFSP only, ongoing support coordinator, and that's the FSC. The family support coordinator is the person who provides ongoing services beyond the intake coordinator, and they are required to attend in person for the initial and annual or any other follow-up IFSP meetings. The FSC needs to be there. People who are directly involved in conducting the comprehensive developmental assessments are required to be at the IFSP meeting, and the EarlySteps or early intervention consultant may also participate in the meeting, either in person or by reviewing the records and information from the meeting. The EI, early intervention consultant, must attend IFSP team meetings for children who are eligible based on informed clinical opinion. And let's note here, if the person or people who were directly involved in conducting the comprehensive developmental assessment are unable to attend the meeting, their participation requirement can be met by having them participate remotely, like, by Zoom or telephone, or having a knowledgeable authorized representative attend for them, or just making pertinent records available for later on. The IFSP is broken down into multiple sections that must be completed. It's quite a document, and it's a little bit overwhelming if you're new to the system. So let's take a look over the next few slides. Let's take a look at the sections of the IFSP. I'm not going to go into great detail, but I want you to be at least familiar with the forms and what they look like and what they involve. Section 1 is child information, and all fields must be completed as they are listed there. Section 1A is general contact information of the family. 1B is the IFSP History and Family Support Coordinator. The FSC, Family Support Coordinator, name and telephone number are listed there. The dates of the initial and the projected date of the annual IFSP must be listed as well. The bottom of page 1 of the IFSP also lists each section and the forms used for the section if they're not included in the IFSP. Section 2 is a summary of family concerns, priorities, and resources to enhance the development of their child. This section lists the concerns of or the concerns for the family and child and puts them in priority order. So they're referred to as priorities. And each priority is marked with the domain area that it addresses. And the domains are physical, cognitive, communication, social, emotional, adaptive, or other. And it also has the resources that are documented there that support that priority. Section 3. Section 3A isn't shown here, but it's the present level of health functioning. Section 3 provides a statement of the child's present levels of physical development, and including vision, hearing, and health status. Vision and hearing should include the date of the last screening, the screening results, and the name of the person who conducted that screening. This information should have been collected during the eligibility determination, and it should be updated annually. Birth history information is only completed at the initial IFSP. The remaining section is completed at the initial and annually. Section 3B is the present levels of development and the BDI-2 evaluation report. And this information is taken straight from the evaluation report and includes present levels of cognitive, communication, social, emotional, adaptive development based on the evaluation results. The BDI-2, as I've told you about it in the acronyms, the BDI-2 is the Battle Developmental Inventory Test, and that's the primary test used to determine eligibility into EarlySteps. This section should give a description of the child's developmental status. And again, the 5 areas of development include adaptive, and that's doing things for themselves, the use of appropriate behaviors to meet their needs. Social, emotional, getting along with others, and all of these say using appropriate behaviors to meet his or her needs. And basically what that means is an infant is going to use different behaviors to have their needs met than a child that's 2 years and 9 months. Hopefully by then a child would be using some words or some gestures that infants don't use. So that's what that refers to. So again, the 5 areas of development: adaptive, social, emotional, cognitive communication, which is understanding and communicating, acquisition and use of knowledge and communication skills. Language begins at birth. Language development begins at birth, so it's never too early to address those language skills. Physical, like moving; cognitive, which is thinking and learning; acquisition, and the use of knowledge and skills. All right, moving on to section 4. That is outcomes for the child and the family. And this is basically the goals section, or the meat of the IFSP. Each outcome or goal is documented separately using a separate page for each desired outcome. This page takes the goal, called the outcome, describes the functional level of the child currently, and then says how the team is going to know that that targeted outcome is met. It gives a timeline, which will be either 3 months or 6 months, and what they expect to accomplish during that time. It then lists the strategies that will be used to enhance the child's pre-literacy and language skills. Example strategies include verbal prompting or instructing, modeling, gesturing, physically assisting, or guiding with verbal prompting. There's also an area to indicate if adaptive equipment or environmental modifications are required to accomplish the given strategy. This section goes on to describe with whom these strategies will be practiced, even if it's the family or siblings, and how progress will be measured. It even has a list of potential times in the daily routine where this particular outcome might be addressed. So it's pretty thorough. If the outcome addressed on this page is a support coordination outcome, there's an area for the family support coordinator to check off how the outcome will be addressed, and that's something that they're doing. Outcomes must be listed and organized in priority order, regardless of the type of outcomes, whether it's a child outcome, a family outcome, or a support coordination outcome. Section 5 discusses the child's transition from early steps. Transition outcomes can be added to the IFSP when the child is around 24 months. Section 5 of the IFSP documents discussions with the family regarding transition, procedures that will be used to prepare the child for transition, program options for the child exiting early steps, and steps to take if the child leaves the program early, like before their 3rd birthday. It also provides a checklist complete with dates that different actions were taken related to the child's transition. For children referred to early steps between 45 and 90 days before their 3rd birthday, the LEA, or the local education agency, their school system, should participate at the initial IFSP meeting. And this should be considered also the transition conference. If for any reason the school system is unable to attend the initial IFSP meeting, then the family support coordinator will invite them to any future IFSP team meetings to discuss that age 3 transition. The transition conference, though, must occur regardless of whether or not the school can attend. The focus of any early steps service needs should be on facilitating transition to future services. If the child is potentially eligible for services through the school system, then that school representative must be invited to this meeting. The Office for Citizens with Developmental Disabilities, or OCDD, and the Human Services Authority or district must also be invited if either will be a potential service provider or if the family requests a determination process for system entry for OCDD or waiver services. At the bottom of this section, there's a list of possible steps and services for transition. These are used for discussion with the family to meet transition needs. Other steps and services may be added. Section 6 documents early intervention services to be provided, and it gives the signature box for parents to consent to services. This page documents the outcome or goal that the service will address, the location, the frequency, starting and ending dates, the method of delivery, even the funding source. The provider's name for each outcome is also given, and whether the service will be provided individually or in a group setting. The parent's signature on the document indicates that the contents of the IFSP have been fully explained and that the parent gives informed written consent for them to start the services that were outlined in Section 6 of the IFSP. Parents should not sign the IFSP until the document is totally complete, and they must be informed that they have 3 calendar days to consider the plan and that no services except support coordination will start before the end of that 3 calendar days after the consent and signature. Section 7 of the IFSP outlines any assistive technology that will be needed, also the transportation needs for the child to access early step services. And if there are no assistive technology or transportation needs, then this page doesn't need to be completed. Section 8 is for other services. This section lists the services such as medical and others that are needed by the child or family, or that they're already receiving, that are related to the child's development, but are not required Part C early intervention services. Certain other services should be listed here, like the child's medical home or their primary care physician, their pediatrician, the child's medical specialist that they see, the child care center that the child attends, any OCDD services that they need or are receiving, other therapy services not provided through EarlySteps, like if they're doing outpatient therapy that's not through EarlySteps, other services the family needs to address the child's development, like parenting classes, IEP trainings that Families Helping Families provides, and any other services that are needed. Section 9 is the list of the IFSP team members and contributors. Section 10 is the justification for early intervention services delivered outside of the child's natural environments. This section lists services not provided in the child's natural environment, and it gives the specific reasons why early intervention can't be satisfactorily achieved in the child's natural environment. It gives the data used to support the team decision and offers ways that the strategies that are being used will be incorporated into the child's natural environment. So some examples of that might be the provider will send a note home after each session, outlining what they did and how the parent can incorporate that. The provider might talk with the parent weekly, biweekly, or monthly regarding the child's functioning. The provider will send home information on the strategies the child is learning so that the parent can incorporate these strategies into the child's routine at home. The parent will call the provider if they're unclear on how to implement a new strategy. And mom or dad will observe sessions when possible. And providing services outside of a child's natural environment might mean that the family takes the child to an outpatient therapy center, for example, for part of their services. Like if maybe the child is home instead of at a center, and the family wants the child to receive services and no one can come to the home, then they might go to a OT or PT service center, therapy center. Every service that's provided to a child that's not in the natural environment has to be listed in this section, even if it requires more than one page. How often is the plan updated? All of these plans have times that they have to be updated, whether it's an IFSP for EarlySteps or an IEP for school. The IFSP must be reviewed within 6 months of the initial or the annual IFSP date prior to expiration of the service authorizations. The first annual IFSP must be completed within 12 months of initial or annual IFSP date prior to expiration of service authorization. So before you can run out of time, it has to be updated. How does my child transition out of EarlySteps? So when your child is between the ages of 2 years, 3 months and 2 years, 9 months, and that's 27 and 33 months of age, your child, your EarlySteps family support coordinator will convene an IFSP meeting to discuss the transition process with you and the other team members in order to develop a transition plan. And this meeting is called the Transition Conference. The transition plan identifies options for your child and your family after your child's 3rd birthday. And some options may be preschool, private preschool, child care, Head Start, developmental disability services through your Human Services Authority, or your local school system, special education services, or other community early childhood programs. The transition plan will include the steps and services your child and family will need to obtain information, review options, visit programs, and make decisions about the appropriate program for your child. So they don't just leave you hanging. After you've been through EarlySteps for any amount of time, you have to have a transition, and they will help you and guide you into what comes next. The transition plan includes steps and activities necessary to prepare the family for the upcoming transition from EarlySteps. Federal law, and that's the IDEA again, requires that planning for transition begin at least 90 days before a child turns 3. Early Steps requires that the transition meeting be scheduled between when the child is 27 or to 33 months of age, or as soon as possible for kids who are newly enrolled that don't start Early Steps until over the age of 2. The transition plan is discussed at all IFSP meetings, including the initial 6-month review and all the annual IFSPs. When the child is 2 years and 2 months, the intake coordinator or the family support coordinator must notify the local education agency that the child is going to turn 3 soon. They have to schedule and convene a transition conference between the ages of 2 years, 3 months and 2 years, 9 months in order to meet the timelines for Part B eligibility determination and IEP development. Now, we talked about Early Steps being Part C under the federal law. School systems, that's from ages 3 to 21, that's Part B under IDEA. If the local school system cannot participate in the conference, the family support coordinator or intake coordinator, if it's a child new to Head Start, child new to Early Steps, must still hold the transition conference at least 90 days prior to the 3rd birthday, and they must have invited at least the school system representative to the conference. The Individuals with Disabilities Education Act, or IDEA, Part B, states that an IEP has to be developed and implemented by the child's 3rd birthday. If they are identified before their 3rd birthday that they have a learning disability or developmental delay, then the IEP has to be in place and implemented by their 3rd birthday. Because of the requirements to provide FAPE, a free appropriate public education, the LEA, the school system, must meet that deadline. School systems must first conduct a multidisciplinary evaluation of the child to determine eligibility for Part B services. Now, they've already been evaluated for Early Steps, but this is a new multidisciplinary evaluation that has to be done because not all children in Early Steps automatically qualify for special education services in school. But required components for that evaluation for Part B services include screenings in the developmental domains of vision, hearing, motor, health, education, speech language, and assistive technology. So who is involved in transition planning? At least the parents, the family support coordinator, and the local school district, and maybe others as well, depending on the needs of the child and the family. What happens at the transition meeting? The purpose of the transition meeting is to discuss and develop a plan for the upcoming transition of the child from Early Steps. The discussion has to include a review of the child's options from the child's 3rd birthday through the remainder of the school year. The discussion must include a transition plan that includes steps to exit from Part C that were developed at a transition conference. It must include any transition services that the IFSP team identifies as being needed by the child and family. And if the child is entering the school system, the discussion will include moving from the IFSP document to an IEP, which is for Part B services, Individualized Education Plan. What are the options? The child's options are going to be discussed upon exiting from Part C or Early Steps, and there are several. Part B, which we've referred to, it's Part B under IDEA, and that's the school system, preschool special education. There are pediatric day health centers. Homeschooling is another option. Preschool, Head Start, childcare, Mother's Day Out programs, outpatient therapies or ABA, and there are other community resources as well. What are the LEA's responsibilities? So the LEA, or the school district, as we've said, is responsible for attending the Early Steps transitions meeting, doing the multidisciplinary evaluation, and developing and implementing the IEP, the Individualized Education Plan. Not every child in early steps is going to qualify for Part B services or special education in the school system. Like I said, this evaluation is what determines their eligibility. The IEP is developed and implemented for the children who do qualify for special education services, and it must be completed and in place by the date of the child's 3rd birthday. OCDD, or the Office for Citizens with Developmental Disabilities, serves as the single point of entry, the SPO, into the Developmental Disability Services system, and it oversees public and private residential services and other services for people with developmental disabilities. OCDD conducts an assessment of people who request services to determine the person's eligibility for system entry. Eligibility is based on the definition of developmental disability contained in Louisiana law and serves as the human services districts or authorities, that's the HSAs, serve as the point of entry for people to receive services. So the human services districts or authorities serve as the system points of entry for individuals to receive DD services and conduct an assessment to determine eligibility for DD services. Children should also be added to the waiver registry through EarlySteps by the time they're 2.5. You may get a phone call or a letter from your parish's human services district after your EarlySteps transition confirming the receipt of your child's records, but it's your responsibility to schedule an entry appointment. You have to attend the entry appointment to complete that eligibility process. There will be documents you'll be asked to bring with you, so make sure that you have a list of those and that you gather those before your appointment. And at that time, be sure your child is added to the registries for the various developmental disability services for which they qualify. And you can ask your human service district or authorities representative that's there at your appointment. You can ask them about all of the available disability services that your child may be eligible for. What are the family's responsibilities? As your child transitions out of EarlySteps, you have to attend the EarlySteps transition meeting. You have to attend the multidisciplinary evaluation done by the school system to determine Part B eligibility for special education. You have to sign consent to release your child's information to the Human Services District. You have to call the Human Services District in your area after the transition meeting to schedule your entry appointment and tell them that you want to go through the eligibility determination and request services for developmental disabilities. You have to attend your entry appointment at your local HSA to begin the eligibility process for developmental disability services. And you have to keep your contact information current with your local school district and your human services authority or HSA. It's very important for all of the people involved in your child's life who provide services. It's very important to keep their contact information and your contact information up to date. All right, this is the end of our presentation. If you need additional support or contact information for your local EarlySteps SPO, please call us. Our contact information is there on the screen at Families Helping Families of Greater New Orleans, or you can call or contact your local FHF center. We provide lots of great information also on our social media channels, so check us out on Facebook, Twitter, and Instagram. Be sure to share or retweet our posts. We love it when you do that. We have a private Facebook group called Disability Talk, and that's for people to share and provide support to each other. It's kind of like an online support group for people with disabilities, or parents mainly of children with disabilities. Our website is also a great source of information. And if you want to be added to our newsletter list, we send out weekly emails about events and trainings and just lots of different cool things that are coming up that may be of interest to you. That goes out on Fridays. We also publish a quarterly digital magazine, which is wonderful, called Exceptional Times, and we email that out as well. So if you want to be on our email list, please call our office at 504-888-9111 and let Miss Liz or whoever talks to you know that that's what you would like. All right. Thank you so much for attending Early Steps Start to Finish. I hope that you've enjoyed this training, and if you need anything else, please feel free to reach out.